Welcome to my channel, Med Simplify. Today we are going to discuss gastro oesophageal reflux disease, GORD.
Anatomy of esophagogastric junction. This junction lies in the abdomen and forms angle of His. The acute angle and the length of abdominal esophagus contribute normal closure of esophagus. Pathophysiology of gastro oesophageal reflux disease. Mechanisms of preventing acid reflux. Transient lower esophageal sphincter relaxations are part of normal physiology, but occur more frequently in patients with gastroesophageal reflux disease, allowing gastric acid to flow back to esophagus. Increased tone of lower esophageal sphincter muscle, angle between the esophagus and stomach, prevent acid reflux. The mucosal rosette, formed by gastric mucosa and the crural diaphragm at the lower esophageal sphincter, which contracts and prevent the acid reflux. The risk factors associated with gastrointestinal reflux disease are obesity, cigarette smoking, fat, chocolate, coffee, alcohol ingestion. Pregnancy causes GORD due to increased intra-abdominal pressure. Other causes are drugs such as antimuscarinic, calcium channel blockers, nitrates, treatment for achalasia and hiatus hernia. Clinical features: burning retrosternal chest pain, regurgitation, reflux, acid taste in mouth, cough and hoarseness of voice due to laryngeal irritation and odynophagia.
Diagnosis is clinical. Investigations are required for gastroesophageal reflux disease not responding to conservative or medical treatment before anti-reflux surgery and presence of dysphagia. First-line investigation is upper gastrointestinal endoscopy. Esophagitis, esophageal erosions and ulcers and Barrett's esophagus can be seen in endoscopy. Best investigation is 24-hour pH monitoring with esophageal manometry. It will show reduced pH. The first-line management is conservative. Weight reduction, reduction in alcohol and caffeine consumption, cessation of smoking, reduced intake of fat and spicy food, avoid large meals at night, sleep few hours after dinner, and sleep propped up significantly reduces the symptoms. The drugs used to treat gastroesophageal reflux disease are alginate-containing antacids, proton pump inhibitors, H2 receptor antagonists, and dopamine antagonist prokinetic agents. Commonly used proton pump inhibitors are omeprazole and pantoprazole. Examples for H2 receptor antagonists are ranitidine and famotidine. Severe diseases may need surgical procedures, which are endoluminal gastroplication and Nissen fundoplication. Complications are short-term and long-term complications. Short-term complications are mentioned under endoscopy findings. Long-term complications are peptic stricture and Barrett's esophagus. During endoscopy, biopsy is essential to make the diagnosis of Barrett's in the presence of intestinal metaplasia. Intestinal metaplasia significantly increases the risk of development of adenocarcinoma. Biopsies are also important to assess the presence of dysplasia and malignancy. Some true or false questions are given. You can go through it. Answers are given here. Thank you. Subscribe Med Simplify to more videos.